My name is Macario, and I'm 11. What happens when someone gets a heart attack?
My name is Mark Garnick, and I am a physician at the Beth Israel Deaconess Medical Center and a faculty member at the Harvard Medical School, both of which are located in Boston, Massachusetts. And the question is, what happens when someone has a heart attack? Okay, the medical term for a heart attack is called an MI, or a myocardial infarction. And that just means that there's been some death of the tissue of the heart. And what a heart attack is it represents a blockage of the blood supply to the heart by some abnormalities of that blood vessel. So the heart itself pumps blood, and it supplies blood to its own muscle through the blood vessels, which are called coronary arteries. And what can happen is, over time and as we get older, and if patients have had high blood cholesterol or diabetes or high blood pressure, what can happen is there can be deposits of fatty material on the inside lining of these coronary arteries that supply blood to the heart muscle that allows it to beat. These fatty materials can actually cause what are called plaques, and the plaques can sometimes rupture, which attracts platelets and other components of the blood system to form a small clot on the inside of the coronary artery. And when such a clot forms, the blood supply to that portion of the heart is now blocked off. And because the blood supply is blocked off, the heart muscle, which has very, very high demands for nutrients and oxygen, actually is deprived of those nutrients and oxygen, and the cells consequently die. And that's what's happening when a heart attack occurs. The blood vessels to a portion of the heart muscle are blocked, there is death of that heart tissue, and consequently there can be some very substantial pain, usually located in the chest area, oftentimes radiating along the left side of the upper portion of the body, that heralds in a heart attack. So again, it's a blockage of the blood vessel leading to death of the heart tissue. The other important problem associated with heart attacks is that when there's been damage to the heart muscle can't contract in its normal fashion as effectively as it has been before, and sometimes the electrical impulses that control the heartbeat become irregular, and that can lead to irregularities of heart rhythm, so-called arrhythmias. So a heart attack leads to damage of the heart muscle, death of the heart muscle, and irregularities of the heart rhythm.